Tri-County Health Department has really always responded to emergencies as a function of its mission. And under those circumstances, we've actually developed our emergency response capabilities over the years. And with the development of the Emergency Preparedness Office, we've really been able to focus our efforts and develop our efforts to respond in a much more concerted and effective way.
We're here to create the plans and procedures and develop agreements with partners so that if there is some non-routine event that we need to respond to, that we're really prepared for that response. We have strong relationships throughout the agency with all of the divisions because we really rely on each other for the subject matter expertise that everyone can bring to the table. So we work very closely in any kind of incident, and we can bring everyone together, and we provide that incident management structure using the incident command system so that we have an effective and efficient response.
Our inability to predict when a disaster, whether it's natural or man-made, is going to occur should not predict our inability to get ready for it. We should be ready at all times. We have to be ready at all times.
So emergency preparedness and response started really, it emerged in the late 90s, early 2000s out of our response team to environmental issues when Department of Justice and weapons of mass destruction training became really available at the local level. It then emerged really officially in 2002 as a functional piece of Tri-County's management team, and then the Office of Emergency Preparedness, as it stands now, evolved between 2002 and current day to really a full-fledged, cross-cutting organization at Tri-County Health that works both internally and with a lot of external partners.
I think EPR has benefited our division by giving us a new set of skills that we didn't have before. This was part of public health, the public health scope of work. We have an E-team, a group of nurses who really does like planning and preparing for these kind of events, and EPR has been a good partner in helping them know what skills they want to learn or how to go about training for this. So it's just given us another skill set that we didn't have before.
It's been a great benefit working with Emergency Preparedness and Response team because they really help us plan for the worst case scenario. It's been able to help us better prepare if something was to happen within our clinics, or could even be a flooding in our clinic and we have to move services for a day, what that might look like. But really thinking through that thought process, having points of contact, and who to go to for resources and supplies.
There was a flood in one of my offices once, and we couldn't go into work the next day at that office, and so the Division of Emergency Preparedness helped us to make sure we had the supplies necessary to transfer to a new location the following day and to come up with a plan to help communicate to our clients where to go the following day for their appointments and to still receive the benefits from the WIC program.
Over the years, the Environmental Health Division has spent a lot of time training in the incident command system, so having the EPR not only actively involved but really supportive of our division and providing that sort of structure for any type of incident, whether it be planned event or an unplanned incident, helps provide that structure and gives us that support needed to respond to those types of incidents.
It's good to know at Tri-County that there's a division that has a working knowledge of ICS and is able to set that up in addition to what we're doing out in the field, that we can actually focus in on what's going on out in the field.
Well, we work with a diverse number of partners throughout our community in Adams, Arapahoe, and Douglas counties, including the city of Aurora. And those include folks from hospitals, behavioral health agencies, coroner's offices, long-term care centers, emergency managers, fire, police, EMS. Those are all partners that we work with on a very regular basis, and by using EPR as a touchstone for the rest of the divisions within Tri-County, we're able to funnel the appropriate information to the right partners, increase situational awareness, maintain a common operating picture across all of those diverse groups during incidents, and streamline the process of both incident response and day-to-day planning efforts.
The community has benefited from the interdivisional collaboration and response with emergency preparedness in several different ways. We're able to tap into different divisions' talents and skills to bring a more robust and full-scale response during an emergency, as well as during our daily activities with the community.
As we begin to think about increasingly how public health focuses big picture on population health, I think the example that we see through emergency preparedness and response, to me, is a great example for how we want the rest of the department to begin to think. So it's got a great future and a very important future in its own lane of activity, which is emergency preparedness and response.
Being prepared for any type of incident is key.
We have trained with the emergency preparedness team. We have learned a lot of the new language, the structure.
That if you fail to plan, then you are planning to fail.
To have a break-in services for those clients that depend on us to receive checks for nutritious foods or any of our referral resources within our program could be detrimental to a family that's really in need.
By being prepared, you're actually protecting yourself, and you're also freeing up response entities to take care of those people who are more highly impacted by whatever incident has happened.
Everybody in the public gets that if you have a crisis, if you have floods, if you have wildfires, if you have pandemic influenza, gee, who's taking care of business for us from a health perspective? The public health department.